Shared decision-making is the idea that patients and doctors should be working together to find the right decision. Sometimes family members and friends can be involved too. And it's the idea that we use not only the best evidence about what are the best things we should be using for good health care, but that your values are also important too. So shared decision-making combines those two things, a patient's values and the research we know about good health care to help patients make the best decisions for them. Shared decision-making is really important because in healthcare there's often not one best answer. What may be the best for you isn't the best decision for someone else. And so shared decision-making lets patients and doctors partner to figure out what is the best decision for your life in your situation at this time. And shared decision-making does that by creating a partnership between patients and doctors, where doctors can help you know the decision, give the pros and the cons of different answers, help you figure out what your values are to come to the best decision for you. Shared decision-making involves 3 steps. The first step is to identify that there's some decision that you need to make. Not every clinic visit has a decision. The second step is when there is a decision that needs to be made, you discuss the pros and the cons of the different options for that decision, and then you discuss your values and how your values interact with those pros and cons. Step 3 is actually making the best decision for you. As a doctor, there are things I need from you so that we can partner in shared decision-making. The first thing is that I want to know your values. What is most important to you right now? Do you need to make sure that whatever decision we make, it needs to let you stay in your current job? Are you someone who really wants to avoid taking medication, and we need to keep that in mind as we make a decision? So the first thing that I need from you is that you know your values and what's most important for you. The second thing I need you to listen as we discuss the pros and cons and ask questions so that I know that you understand your different options, what would be good, what would be bad, the pros and the cons, and that way you can make an informed decision. And then the third thing is I need you to work with me to actually make that decision and figure out what's best for you.